Hello class, this is Musculoskeletal Part 2, and this is where Chapter 32 begins. So we're in the chapter Care of Patients with Musculoskeletal and Connective Tissue Disorders. In your book, it begins on page 736. I've told you before, now that you are the nurse in your family, you're the nurse for your child's soccer team, you're the nurse at your child's gymnastics, accidents are going to happen and people are going to want to know from you, is it sprained, is it strained, is it broken, etc. You know that they have to have an x-ray to find that out. And I think I mentioned to you that I kind of go by the pain that people are having. But anyway, we're going to go through definitions of these things, these disorders, and we're going to stop this part when we start talking about fractures. That's going to be in part 3. Okay, so let's start off by looking at sprains. A sprain is a partial or complete tearing of the ligaments that hold various bones together to form a joint. A sprain occurs when a joint may be forced during trauma past its normal range of motion, or there may be twisting. The ankle, knee, and wrist are the most commonly sprained. Certainly an NSAID, if the patient can take it, is going to help this type of injury. It could be due to a fall. You've probably had a sprained ankle before yourself. Maybe, maybe not, but we're going to talk about what you can do for it here in just a second. Okay, we have got different ways, different grades here as far as classifying the sprain. A grade 1, mild tenderness at the site, minimal swelling, loss of function, no abnormal motion. Grade 2, more severe pain, especially with weight bearing, swelling and bleeding into the joint, some loss of function. The person that has a grade 2 will feel like they cannot put pressure possibly, and they feel the need to rest the area. A grade 3 is a severe complete tearing of the fibers. Definitely they're going to need to rest. We'll talk about ice, compression, and elevation in just a moment. Sometimes a grade 3 sprain may need to be casted or even have surgery. And the diagnosis for this, as we just spoke about, physical examination. You may see some heavy-duty bruising when it comes to what a sprain looks like. Over the course of about 3 days, it can worsen in intensity. And an x-ray to rule out a fracture or other pathology. Okay, so let's talk about rice here for just a second. So in rice, of course, we have rest to protect it, ice to decrease pain, swelling, and inflammation, C for compression with an elastic bandage, and E for elevating the affected area if appropriate. And this can go on for 48 hours. Your PowerPoint here says 24 to 72 hours after the injury. If it's 48 hours after and it's still quite swollen, the bruising is still continuing, the pain is still very much there, then go ahead and continue the ice for the next 24 hours. But after 48 to 72 hours, then heat can be used on the injury. But when we're thinking about rice here or applying ice to someone for therapy, we have to be very careful about not getting the limb too cool or not using it too much. So applying the ice can be for sessions of 10 to 20 minutes every 1 to 2 hours to minimize swelling and pain. And the compression, of course, is to stabilize the area. The ligament is going to heal by scarring, and this person can gradually start to exercise the area again as they feel comfortable doing so. I underlined in my notes here elevation. Just to know, when you are taking a HESI exam, taking an NCLEX, we do think of elevation when you have an injury, when you have a sprained ankle, when you have, swelling just from having edema in the feet or something like that. But also, elevation is used for sometimes when a cast is applied to an area after surgery, the limb will be elevated post-surgical. And also, elevation can even be used for an amputation. We're going to look at that at the end of this chapter. But it could definitely be a therapy that's used for puffiness after surgery, elevation. Also for a sprain, of course, NSAIDs can be given to help with the pain if the patient can take that. Muscle relaxants may also be used as well. Okay. All right. I think we already mentioned this, but for a grade 2 or 3, resting the joint, crutches, yes, they may need to be used to keep the patient from bearing weight on the joint. For a lower extremity sprain, and the NSAIDs may need to be given around the clock for the first couple of days. All right, let's talk about strains. Signs, symptoms, and diagnosis. With a strain, there could be a history of overexertion, soft tissue swelling, pain, and bleeding if a muscle is torn. So it could be in a muscle, a tendon, or both. And it can be very painful as well. The back muscles are the most common area for muscle strain, but also it could occur in the skeletal muscles like the hamstrings, quadricep or calf muscle. And NSAIDs can be used for that as well. We went through all that. Okay, soothing sore muscles. We've got some different essential oils listed here. Valerian or kava tea, honey or apple juice can be added to make it more palatable. And also, I don't think it's in your chapter, but CBD oil is becoming a new therapy also for helping with joint injuries. I do not think it's FDA approved yet, unless I am incorrect, I may be. And someone who is pregnant or breastfeeding needs to use caution in using essential oils or teas for therapy for sore muscles. They need to ask their physician first. Okay. Ice and compression should be immediately applied if a strain, and the part should be rested. Patient is taught to use ice for 20 minutes out of the hour only. That's a good rule of thumb. And when compression is used, the distal parts of the extremity must be checked for sensation and adequate circulation. I will say that again. When compression is used, or a cast, or I will add also post-surgical for a reduction of a fracture. Anytime a limb has had an injury or had a surgery and it has a bandage, cast, splint, dressing after surgery, anything like that, always the distal part of the extremity, such as the fingers, the toes, need to be checked for sensation and adequate circulation. So they should look pink. They should not feel cold to the touch. So those are important things to check for. If you can check a pulse, that needs to be done. And also check and see about the person's pain level. When they have on a cast or coming back from surgery post-op, and have a big bandage on an extremity, their pain level, of course, they're going to have some pain. But over the hours that pass, their pain should improve. If you have an increase in pain, there could be something wrong underneath that cast or dressing or splint or whatever. So that needs to be checked out. I think I already mentioned heat can be applied after 48 hours if the patient desires, or if someone's treating a strain or a sprain at home. Anti-inflammatory medications are used, we said that. Muscle relaxants could be prescribed. And time is the greatest healer. So this person needs to rest the area that they have injured. And keep in mind, let's say that you sprained your ankle 6 months ago. Then maybe you shouldn't jump out of the back of a pickup truck. It's going to take time for these soft tissues to heal, and it is much easier to re-injure the joint. So they need to make sure that they understand the possibility of re-injury is greater after a sprain or a strain. Proper ways to lift and move. So stretching is very important prior to exercise. And sometimes, as we said, surgical repair may be necessary even for a sprain or a strain. All right, dislocation and subluxation. Dislocation is complete dislocation of a bone, and subluxation is partial dislocation from trauma. The most common sites are shoulders, knees, hips, ankles, and the temporomandibular joint. Usually there's an outside force injury, such as getting punched in the jaw, severe pain aggravated by movement, muscle spasms, abnormal joint appearance, and it is diagnosed with an X-ray. So there is a tearing of ligaments around the joint, and it is very painful. Reduction or getting it back in place can be very painful. Usually surgery is required for repairing or reducing what's going on under anesthesia. A manual reduction or replacement of the joint in place could be used, and I know you see that in movies a lot when there's like a war movie, or they grab someone's arm and snap it back into place, you know, or something like that. But typically that's going to be done under anesthesia. Treatment for this: stabilization, rest, also checking, as we said before, the color of the distal appendages and checking for swelling as well. Nursing management is aimed at pain control and encouraging rest of the affected part. Heat or cold applications may be ordered. Bursitis. Okay, when you think about bursitis, I know you think of your grandma, you know, but actually people who are even in their 40s or so, they can get bursitis. It's very painful, and it's an inflammation of the sac that is, shall we say, lining the freely movable joints. And it's usually from overuse. Let's think about someone who just gets overzealous and they start running and they haven't been a runner previously. Maybe they're not stretching appropriately. Then they could be at risk for inflammation of the bursa sac, it's called. And it can even rupture. So it can cause a lot of pain, mild to moderate aching pain, swelling. There could or could not be a history of a particular injury. Treatment is rest. NSAIDs can help. An ice wrap can help. Hip, elbow, shoulder, or knee are the most common areas for that. They can have some pain, like it says for physical examination. If you're assessing and you are just palpating around the area, you may feel some heat there. You may feel, or they may tell you that they have pain when the area is pressed. They also can have a bursa cortisone injection. And activity limitation, remember a few minutes ago we said time was the healer. Same thing with this, with bursitis. Other connective tissue disorders that I would like for you to read through: rotator cuff tears, ACL injuries, meniscal injuries, Achilles tendon rupture, and bunions also. For a rotator cuff injury, it's usually from a repetitive act. Someone has been throwing a ball or dunking a basketball. I don't know if that's a good example really, but it's a repetitive injury which causes a rotator cuff. Making overhead motions with the arm. Treatment consists of rest, sling support for the shoulder, NSAIDs for discomfort. Sometimes it's treated with injections of steroids or anti-inflammatory drugs. And heat is recommended before exercising the joint. If it does not heal, surgical repair is indicated. An ACL injury is usually associated with some type of sports like skiing or something like that. Usually the patient will hear a pop and then the knee will feel unstable. They'll have swelling, pain. It's diagnosed with an MRI, and usually they will make the patient immobile by applying a brace, measures to decrease the swelling, rice therapy, physical therapy, and if that doesn't help, then surgery may be recommended. A meniscal tear in the knee, when they're having an exam, a click will be heard when palpating and moving the knee. It's usually due to a sports injury as well, diagnosed with an MRI. And a bunion is, there is actually a bursa sac around the toe, and this can happen more commonly with women, diagnosed with physical exam, and sometimes with bunions, surgery is required as well, but a corticosteroid injection could be tried for that as well. Some people are more common to pick that up with their heredity. I did want to mention a couple, if you will add this to your PowerPoint, a couple of terms I would like for you to be sure and add to study. I mentioned this when we were talking about chapter 31, but I wanted to add it in again. Arthroscopic surgery is a joint inspection to diagnose a problem within the knee, and it's done with a camera buttonhole incision. And after an arthroscopic surgery is done, I remember mentioning this in our last YouTube lecture, but the patient only needs to be off of the knee just that day. It's a same day surgery typically. And then they can be weight bearing more than likely that evening after the surgery, and they need to do straight leg raises. If you're assessing them in the hours prior to them going home, just have them do some straight leg raises. And arthrocentesis is drawing fluid off of the knee for inspection to take a look at it. So just wanted to add those couple of terms, and I think they're either in chapter 31 or 32 in the blue key term section that you can look through. Crepitus, also add that, which is a grating sound that can be heard and felt upon palpation of a joint. Okay, carpal tunnel syndrome. Go ahead and add this before we start talking about fractures. It is a compression of the medial nerve in the wrist carpal tunnel. It occurs with swelling in the tunnel, associated with the finger, hand, arm, having numbness in the area. So they could have finger numbness, hand numbness, arm numbness. For treatments for this, a splint could be applied. Anti-inflammatory medication taken. Treatment also can be just resting the area, changing the angle of the wrist during repetitive movements. And if this doesn't work, surgery sometimes is necessary, and neurovascular checks need to be done after this surgery. Also, checking for warm fingertips. Sorry about that. Checking for warm fingertips. And with a carpal tunnel surgery, sometimes there is a period of weeks where they will have to be in the splint in a period of rest. And also with the nails, after the surgery, check for a capillary refill. I didn't mention that earlier, but that if the nails are obvious, either toenails or fingernails, they can be checked for a capillary refill, which is just putting some pressure and checking for the return of the pinkness. Okay, well that gets us to the point to talk about fractures in this chapter. So this is the end of musculoskeletal part 2. Thank you very much.